Who we are. We are an organization that we are a non-profit organization. We have been working together with refugees and precarious migrants, non-status people for almost 30 years. Our organization was founded by two former refugees from El Salvador in the 80s, Loli Rico and Francisco Rico, and they continued their mission. They started with one house, and now we have 4 houses. In the picture that you are seeing, we are the main offices, and also in the other 3 houses, we host mostly women and children. These are our services. We provide settlement services. We have a program for access to education. This is especially for non-status people that they have problems register the kids to school. We have a vibrant youth network. Then if you have a family member who is a youth or identify as a youth, they can join us. Now, because of the pandemic, they are doing everything virtually, but I really strongly recommend it to join it, the network, because that will give you a lot of connections, free trainings, then it's really good. Also, we have the Anti-Human Trafficking and Migrant Workers Mobile Program. As I said, we have the shelter for women and kids, and we have the public education, and these series of webinars are part of the public education. Also, we have the Immigration Help and Refugee Protection. I'm the one who coordinates this area, and that's why we try to provide these free webinars. And also, whatever I'm sharing with you today is part of our learning and experience working together with refugees, precarious migrants. It cannot be considered as a legal advice. It's just from our experience working with for more than 30 years in immigration and refugee issues. Then we are going to talk about the temporary. This webinar is going to focus on the temporary pathway to permanent residency for healthcare workers. Probably everybody knows that on August 2020, the government did an announcement, a public announcement, that they were going to consider a new pathway, a pilot project, for those that had been working during the pandemic in the healthcare sectors. Many organizations that work with refugees and precarious migrants, we were trying to ask the government not to have just a pathway for refugee claimants. We were asking for rejected refugee claimants and non-status people. And also we were asking not only those that had been working in the health sector, but anyone that was risking their life as an essential worker. But unfortunately, the government said that they have to do negotiations with Quebec, and that's why it's only for refugee claimants, rejected refugee claimants that are working in direct patient care in the healthcare sector. During the presentation, I'm going to talk more about that. Then finally, they roll out the program this past Monday on December 14th. They said they are going to start receiving applications. One thing that I want to clarify to you is that if you believe that you have the experience, that you have the qualifications, and you meet all the requirements, the applications are going to be open until August 2021. Then I know many of you want to send the application right away. What I want to say is there is no like, if I don't apply tomorrow, then I will not get it. No, then be careful. Try to understand the process, and also our organization may assist in these applications, but it's going to be on January because we are almost closing down for holidays. Then the announcement was extended to refugee claimants that who contracted COVID-19 and subsequently passed away. Then they are recognizing that those refugee claimants that die, they are going to accept the family members, spouse and common law and dependent children that arrived in Canada before August 14. That was not previously announced on August 14. Then we welcome this announcement. Also, they are saying that if you were, for example, studying as a PSW, personal support worker, and during the months of March and August, you were doing your internship, like as a placement student, then they will consider this time as part of the experience that they are requesting. Then this is good too, because many people were saying, I was not working, I was a placement student, I was doing an internship. Then they recognize that they were working too, pay or unpaid internship or placement. Then who can apply? Then if you claim asylum before March 13, 2020, if you claim after March 13, you are not part of this program. You need to have issued a valid work permit, and again that you have been working in the healthcare sector, in health institutions like hospitals, long-term care homes, that you were probably working as a PSW in a home setting, but it cannot be like private. It needs to be through an organization or agency. We know that many agencies, they hire the staff and they send it to private home care. Then those are the ones that are qualified, and assisted living facilities, and have been working in this designated occupation. You need to be like, in total, the experience they are asking is 6 months, but from those 6 months of experience, at least 120 hours they need to be between March 13 and August 14. I really want to emphasize in this because we have been getting calls. Many people is saying, well, I'm just going to start working, or I just start working as a PSW in October. And because in the program, they said you will have until August 2021 to gain the experience. But one thing is that you must be working, that you have working 120 hours between March 13 and August 14. And remember, could be your internship or placement. Then this part will disqualify many people that didn't work during this time, that they start working, for example, in September or in October. Then they will not have the 120 hours between March 13 and August 14. Then what are the occupations? The designated occupations that will make you eligible. Orderlies, nurses aides, patient service associates, and assistant orderlies in certain home support workers. I know it's like too narrow, or who is a patient service associate. Then I'm going to talk in these next slides specifically who is these people. Then again, to qualify to be eligible to apply for this, you need to demonstrate that you have 6 months of experience. And again, you will have until August 31st, 2021 to gain this experience. But again, from these 6 months, you must prove that you work no less than 120 hours between March 13 and August 14. And if you want to move to Quebec, they have their own selection policy. This is for the rest of Canada. And also, you must still be admissible, especially for criminality and security background. We know that many people, for example, they can be deemed inadmissible because criminality. And how this happened? We have many refugee claimants that have been waiting for a hearing in Canada. And for example, they get in trouble and they get a criminal record more than 6 months. Then these people are going to be deemed inadmissible. If you have a criminality or security record. Also, if you go to cic.gc.ca, at the end, I'm going to put the link. You can see the specifically what are the requirements for each of these designated professions. Then there is something that is called the National Occupation Standards. Then it's called NOC. These NOC were created under the Express Entry program. Then if you go to the website and you just search for the NOC, if you are a nurse, then you need to look for the NOC 3011. But I know that many of you probably you are nurse aides or orderlies and patient service associates. Then go and look for the NOC 3413. Or then you will be, and they will tell you specifically what are the requirements to be considered an allied primary health practitioner, for example, the NOC 3124, and the home support workers, that's the NOC 4412. I was researching yesterday, and I believe most of our clients that have been contacting us will qualify for the NOC 3124 and the NOC 4412, the last two, because the top three are like registered nurses, doctors, physicians, dietitians, then, and also we know that many refugee claimants, they need more time or become a permanent resident to be like licensed practical nurses, for example. Then I believe the last two NOCs are the ones that you need to check it out to see if what you have been doing during the pandemic in the institution that you work, that will give you the qualifications. Then another question is, okay, I had been working in a nursing home and I was cleaning or working on the laundry. Unfortunately, you will not qualify because explicitly they said that you provide direct patient care in these jobs, like bathing them, feeding them, providing medicine. Then this is when you go and see the NOC, probably you will have many questions, but all of these requirements is that you provide direct patient care in these jobs. That's why I was saying that many people that have been cleaning in hospitals and in nursing homes, unfortunately, they will not qualify because they didn't have the direct patient care. And that's why it's important to check the NOC, the National Occupation Classification, because most of the main duties are listed there. Then you need to see, okay, this is my job, and yes, I meet most of the requirements that the National Occupation Classification sets. And again, this will you find it in the IRCC website. It's really easy to find it. Then how it works. Because many people have questions. Okay, what is if I'm a refugee claimant, or if I'm a rejected refugee claimant doing an appeal, what is going to happen with my case? Then also during the weekend before August 14, the IRB, they announced a public policy. And then if you have a refugee hearing pending, means you don't have a date to go for a hearing, then your application is going to be like put on hold until the new permanent resident application with IRCC, Immigration and Refugees and Citizenship, will go through. Then your refugee case will be put on hold. Also, the Immigration and Refugee Board is saying, for example, if you have received already a refugee hearing that is going to happen with the 34 days, within the 34 days, you need to apply, and you need to send the evidence to the IRB. Because in general, how this is going to work, the IRB said, if you don't have a date for a hearing, you don't need to contact us, or your lawyer doesn't need to contact us. The IRCC, Immigration and Refugees and Citizenship, will tell us a notification saying, okay, this person applies for the new pathway program. Please put on hold the case. What the IRB is saying, don't tell us to put on hold your case. It's going to be an official notification from immigration to us. They are only advising refugee claimants that they have in less than 35 days a hearing. For example, if you already have a hearing coming in January 10, then you need to send the application, and you need to send like evidence that you apply for this new program. Because in the meantime that you send the application, immigration will open it. Probably the day of your hearing will arrive. Then you need to send evidence. Okay, how am I going to prove that I applied? For example, the payment of the receipt of your payment. That you send the application. That will be one, because it will take some time to get an acknowledgement letter from immigration saying, yes, you apply. But they said that if already your hearing started, we have cases, I'm going to explain this in detail. We have cases that refugee claimants had been called for a hearing, but at one point of the hearing, the board member said, I'm going to stop this hearing because I need to do a research, and I will call you for a second hearing. If your hearing already started, means you went one day for the hearing, something happened, the board member says, I will call you for a second hearing. I have cases that the IRB stopped the hearing and called the person 2-3 times. These are really, really complex cases, okay? Then don't worry, this is no normal. This is not regular. But they said if your hearing already started and they have like a strong evidence about your case, then they will not pause your refugee case. They will go forward. But what we said to the clients is, don't worry, if the IRB reject you, you can still apply for the new pathways with immigration, because this application again is for refugee claimants still waiting for a hearing, or rejected refugee claimants that are doing an appeal or to the Refugee Appeal Division, that are doing an appeal to the federal court, or that they already did the 2 appeals, they are doing a humanitarian and compassionate, or they are just waiting to do something. Then if you hearing already started and they reject you, you can go to do this application, because remember, you can apply for this new pathway until August 31st, 2021. Then if you apply for the new pathway program, and if they send you a letter saying you qualify, your application is almost approved, you qualify, you pass all the admissibility, like criminality, healthcare admissibility, then the IRCC will request you to withdraw your refugee case or your refugee appeal. But you cannot withdraw right now, okay? You need to be careful. You only will withdraw your case if IRCC immigration is letting you know. You will get a document, a letter from official letter from immigration saying, okay, your new application was approved, please withdraw your case. Many clients are telling us, okay, I need to withdraw right now, I need to abandon my case right now. No, because if you abandon your case, your refugee case, then you don't qualify for the new program, okay? Then you only withdraw your case when you receive an official letter, and then you will send a notice of withdrawal that is a document, it's a form, a simple form to the IRB. If unfortunately your permanent residency is refused because you don't qualify, you thought that the job that you did have all the requirements, but immigration said sorry, no, then you remember that your refugee case was put on hold, then they will send back your case for determination with the Immigration and Refugee Board. Then you will have your time for a refugee hearing again, okay? That's really important, that if they refuse you, you will go back again as a refugee claimant and you will have your date in court. Also, what happens if I'm doing an appeal? Then again, if you are doing an appeal and you apply for the new program because you believe you qualify, then IRCC will contact the Refugee Appeal Division and they will let know the IRB that you are applying for the new pathway for permanent residency. Then the Refugee Appeal Division will put on hold the appeal. If you are doing a humanitarian compassionate, we have many cases. Our office, we do a lot of humanitarian compassionate application. I have some cases that they are calling me and said, Diana, I have been working as a PSW. I have all the experience. What can I do? Then if you just send your application, also this, I talked to other lawyers to see what we should do. Then this is what we come out. Probably you agree or you don't agree, then you need to talk to your lawyer if this is your situation. I've been telling the clients, we sent you humanitarian and compassionate 2 years ago. And we know on the website that they are processing your application. Then probably you are close to get an answer through the humanitarian and compassionate. Then wait for your humanitarian and compassionate answer. But if I just send it 6 months ago, 8 months ago, I will move it to this new pathway application. Yesterday, I have a client. We sent it 2 years ago, but we sent in October, we sent an update telling IRCC that this person had been working as a PSW in a nursing home during COVID, that she has more than 6 months, the experience. Then we sent an update, and I'm pretty sure that with the update that we told IRCC, she's going to get a positive decision. Then if you send a humanitarian and compassionate, for example, 1 year ago, please talk to your lawyer and send an update that you have been working as a PSW, or if you want, you can move it to the new application. Why the person yesterday that we sent the application 2 years ago, she said, I will wait for my humanitarian compassionate decision, because she said probably many people is going to apply for this new pathway and it's going to be delayed again. Then I don't know when I'm going to get my decision. And I believe she's really, really close to get a decision under the humanitarian compassionate. Then we decide to wait. If by any chance, you never know, she gets a negative decision, then she can apply again for the new application. Then you need to assess your situation and see if you want to move your case to the new application, because remember, you can apply until August 31st, 2021. Then I will send, if I send it a long time ago, I will send an update. I made them clear that I have been working during the pandemic, that I have all this, and I will wait for a decision. If before August I will not get it, then I will send to the new, I will move it for the new application. And when you move it, you don't need to pay anything. It's just to let IRCC that you want to move your application for the new pathway. If something important, if these days you have been receiving a negative decision, the Refugee Appeal Division, before the pandemic, in total, you have 30 days to perfect the appeal. Now they are extended to 45 days. Yeah, this is just like a comment for those that have been receiving a negative decision this day, that you will have extra 15 days to perfect the appeal. This is more like describing who can apply, who is related to the patient service. Then this is the list. But again, this list, you will find it in the NOC, in the National Occupation Classification. Okay, before the questions, also I want to say that there is also eligibility, who can apply. Then again, if you withdraw or you abandon your case, you cannot apply now. And we have cases that people abandon the case and just stay without status. Unfortunately, they cannot apply. Or if you are a rejected refugee claimant, and in your rejection, in your document, you receive that says that you are with no credible basis, then you cannot qualify for this process. Many people get a letter saying, we reject your refugee case and we couldn't find you protected person convention refugee. Those people can still apply. But if in your document, when you were rejected from the IRB, says that they reject you because it was manifestly unfounded with no credible basis, then you cannot apply. But it needs to be written in the document. When remember that you get the reasons, it's not there. It's in the first document that has your name or the name of the families and said you were not found a convention refugee or protected person. You can still apply. But if in that letter, in that document said you were not found credible, these people cannot appeal and these people cannot apply to this. Okay. Another thing is how I can get my experience. Then remember that you need to have the 120 hours between March 13 and August 14. They said that you don't need to have worked your hours consecutively in one period. Okay. If you took break or vacations, if you change jobs, and there is a period that you didn't work, doesn't matter. Okay. Also, if IRCC is saying, if right now you don't have the 6 months, but you believe you are going to continue working, for example, as a PSW in a nursing home, you can send your application and we will let you, we will provide you time until August 31st, 2021 to send proof that now you complete the six months. Then again, if you don't have the 6 months experience, but you believe you are going to acquire it, for example, I have a client that told me, Diana, I will get the 6 months or at the end of January. Then she can apply on the first week of January, and we will let know IRCC that later on we will send the proof that she complied with the 6 month experience because she already had the 120 hours during March 13 and August 14. She was doing her placement in a nursing home. We have, let me see, I don't see the link. Oh, here, okay. If you go to this link, you will find a really good explanations about the public policy, who can apply, how to apply, and after you apply. There is some forms that you need to fill it out, and the forms you will find them in this link. I'm going to see if I can show it to you. Give me 1 second. Okay, I probably need Carolina's help because I cannot show. Okay, let me see, I copy this. I don't know if you are seeing it. Yeah, okay. I don't know if you are seeing the website now. Just, okay, I hope you are seeing it. Then you will see here the CICGC.ca website. Then this is the first one. It's about the public policies, everything that I talked to you. Then who can apply? Again, it's everything that we talk, the experience, the knock. But the part that I want to show you is how to apply. Then here you have the instruction guide and you will have the forms. I want to tell you that these forms are very similar to the ones that you fill out for your refugee claim, or if you did a humanitarian and compassionate. This generic form appears in most of the applications when you apply for a refugee case, when you apply for a sponsorship, when you apply for humanitarian and compassionate, when you apply for a permanent resident. This generic application is the same. Then you can go check your package that if you did your refugee case, go and check the generic application form. That will guide you. The difference now is probably when you just need to update it, because if you change your address, if you change your phone number, but it's really simple. You can guide yourself with your refugee package. This additional dependence is the continuation of the generic form. Many people is confused with this one, but what I'm saying is, for example, the generic application form, you have a family of 7, wife, husband, and children. Then in this generic form, you can only add the principal applicant. The principal applicant in this case is the person who is working in the healthcare sectors. If it's the mom or my dad is the healthcare worker, and that he's going to be the principal applicant. And after, you will find that you need to add dependents. Then in the generic form, you can add like 4, maximum, I think 5 dependents. Then if you need to add 2 more dependents, you will this additional dependent. Then this is the continuation of the generic application. But if you in the generic you only have 2 persons, then you don't need the additional dependent. Okay. You need to fill out the Schedule 8. The Schedule 8, you fill out this with your refugee claim or your humanitarian and compassionate. In this one, they want to ask you, remember that they ask you what you have been doing for the last 10 years, where you have been living for the last 10 years. This is the Schedule 8. Then you can guide yourself with, again, the 4 in your refugee claim package. If you don't have a copy, please request it from your lawyer, okay? Some lawyers, they don't give you a copy. I don't know why, because it's your right. Then go and ask your lawyer to provide you with the copy of these documents. And the additional family information. This additional family information, sometimes if you have been applied for a work permit, sometimes you have it there, but the additional family information is, again, who is your mom, dad, if you have children, and if you have brothers and sisters. The new one is the Schedule 1. But the Schedule 1 is just questions. Where you have been working, if you claim protection, when, if you have been inadmissible, or it's just questions about your work experience, where you have been working, from which time to another time, the name of the employer, or if you did an internship. Then it's really simple. And then the document checklist. Then again, you need to fill out generic form, Schedule 8, additional family, and Schedule 1, and do the checklist. And with this, you need to include like proof or your employment, like a letter of employment, and that letter of employment should say, okay, this person had been working here since, for example, since May until now. She had been working these hours and she's earning this. And if you can get specifically your duties, that will be better. Okay. Then I hope this will help you. Again, try to fill out this, and our organization, we don't have the capacity to assist everyone to fill out this, but if you come in January, we are going to reopen on January 11th, okay? And if you come on January 11, we can review the forms and make sure that your package is complete. We can help you to pay the fees. I forgot that you need to pay $550 for each adult that is going to be part of the application. For example, if you are the principal applicant and you are included your husband and you are including 3 children, each child that is not permanent resident or Canadian citizen, they need to pay $150. Then for each adult, $550, and for each child, $150. And also you need to pay $500 for your permanent residency, but it's not mandatory that you pay the $500 for the permanent resident. You can pay just for the application, $550 for each adult and $150 for each minor. And then you can pay this. We can help you to put all this package together and you will send it. But again, because we are closing, we can do this in January. We will assist, we'll try our best to assist as much as we can. But the forms need to fit it out ready. We can check the forms and probably make some changes, but we cannot start from zero filling out the forms, okay? Then if you have family members in your you have a child that is in high school, ask them to help you. You have a neighbor who is having computers, ask them to help you, okay? And then have the package together, have all the documents, go read everything, all the eligibility requirements, have the package together, and we can review it in January when we start working again. I'm going to open my camera. And I'm going to see the questions. Let me see. Okay. Okay, there were some people that couldn't hear us. Sorry, I hope you fixed the problem. Okay. I work as a frontline worker in a homeless shelter and long-term care home. Do I qualify for this opportunity? In the shelter, in homeless shelter, no. But if you work in a long-term care, depends. If you were doing direct care, yes. But again, if you were cleaning or you were cooking or you were working in the laundry, no, it needs to be related with direct care. But if you work in that long-term care as a PSW and you don't have the 6 months, remember you can acquire the experience until August 2021. What about those that they have not received their work permit yet but have their PSW certificate? If you don't have a work permit, you don't qualify because they said that you must have a valid work permit on March 15, and that you must ask for refugee protection before March 15. I know, Morique, most of the people that they don't have a work permit were those that had been waiting for the eligibility interview. Then, unfortunately, then you will not qualify. You need to have a valid work permit before March 15. Okay, there is, okay. Refugee claimants with refugee claims rejected to be manifestly unfound or with no credible basis are not eligible to apply under this program. Can you tell more about this, please? Okay, Alejandro, I already said that yes, unfortunately, no. But please don't be confused. There are people that have been not found that they said, well, we have credibility issues, but that credibility issues was written in the reasons. You can still apply. Those that cannot apply is that in the document that they said you are no were not credible in that document, then yes, you can apply, but they can apply for humanitarian and compassionate. Yes, they have been working in during COVID-19. Refugee, okay. I have a hearing date for February 4. Can I apply for the pathway? Well, if you in Egypt, if you think you qualify, you can apply, and then you need to talk to your lawyer that you want to put on hold your hearing, okay? But then the IRB will request you proof that you apply for this. Hello, I have a question. If the PR accepted for the mother, what will happen for the rest of the family who all apply for refugee claim together? I already said that this, you can include the family, but the family has to be here in Canada, and the family has to be arrived in Canada before August 14. Then you include all the family members that are part of your refugee case, but it needs to be dependent. Okay, it's different if you apply, for example, with your mother. This person doesn't depend on you. Is for dependents, means a spouse, common law partner, or children. Are the applicant's children part of the application or have to be sponsor later? If your children are not here, you need to be first be landed, become a permanent resident, and then you can sponsor them. But if they are here in Canada, they can be part of your application. Kathy, based on the generic form IMMM008, the application form has not been updated with the new category in question 2. Any advice what to include in this space? Oh, okay. You can choose. Okay, I need to see the options, Kathy. Yeah, I know, because when you open the generic, it says as a protected person, as a family member. I will choose as a family member, but Kathy, I need to check it out. Okay, what we can write there, and Kathy, you can write to the email provided in the link, and then I will answer to you back. Okay, that's a good question. Thank you. Okay, Christina, HNC applicants that did not make a refugee claim that had been working healthcare categories can still apply? No, it's only for refugee claimants and rejected refugee claimants. But then, Christina, I will make sure that you send an update to IRCC letting them know that you have been working as an essential worker, and I've been doing it, and we have been getting positive decisions for people that have been doing essential work during COVID-19. I send updates saying, Christina, talk to your lawyer if you have a lawyer, or if you don't have a lawyer and you did it by yourself, send an update with your application number. Pauline, I have been working at shelter as a shelter support worker. I'm eligible for the pathway to permanent residency. It's only in the healthcare sector, unfortunately. they don't mention shelters because it's related with patient care. Do applicants need to have a diploma or certificate besides job experience to apply? Well, remember that to be a PSW, you cannot be a PSW without a diploma or certificate. The applicant should have valid work permit to apply for this stream. Ajisha, yes. So refugees who apply for HNC can apply for PR if they are eligible? Yes. And I already talked about this, that you need to decide if you have been waiting long enough to see that you are close to an answer or you want to move it, you can do it. I'm qualifying looking at the requirement, please. My son is on autism spectrum. It's gonna affect my eligibility, Chichi? No. The autism spectrum is not part of medical inadmissibility anymore. Then this will not affect you. This was changed in 2018. In 2018, the government recognized that they were giving ineligibility for medical reasons to families that they have a family member with autism, and now this is not. Then don't worry, the autism of your son will not affect your permanent residency. This was taken from the inadmissibility, medical inadmissibility in 2018. Then you are okay. I just recently, we won a humanitarian and compassionate case for a former caregiver. She applied in 2017 and the whole family was deemed inadmissible because one of the child's back in their country was with autism. Then she came to FCJ Refugee Center. We did a humanitarian and compassionate, and now she's a permanent resident because autism is no more deemed inadmissible. Okay, then you are okay. Chichi, you don't worry, you can apply. Will T4 work as a confirmation of employment or the letter from the employer will be required? Ajisha, I think the letter of employment, it will be required, but if you are not working anymore, but you had the 6 months and you can prove it with the T4, I think that will work. For Lavi, which of the NOC the people that work as a community shelter worker? Again, go and check the NOCs. I already give it to you. There is no shelter workers there. Do we need a policy clearance certificate? They will, not with this application, but they will ask later. Sorry, just one second. Anyone who applies sorry, to get to qualify for a permanent residency, they will ask a police clearance certificate from back home. But this is going to be part of the process. You can start, you can send this application without a police clearance from back home. I have a brother who we are in the same claim. Can I include him in the application? Drusilla, I think this is for dependents, and your brother is not a dependent. Do we have to send a copy of pay stubs? If you don't have a letter of employment, you can include the pay stubs, you can include the T4. Keletso, supposing I apply and approve for this pathway, how will that work for my children who are in Canada? Okay, they will not get the permanent residency at the same time. You will get the permanent residency, Keletso, and then you can sponsor them, okay? Sophia, I'm a nursing assistant. I don't have a work permit. I get the experience for 16 years caring for the elderly. Sophia, you need a valid work permit. Omolayo, I was in training for PSW June to August and I started working on September. they said that you must have at least 120 hours from March to 13 to August 14. Then on Malayo, I think you will not qualify. Pauline, I've been working as a frontline working as a homeless shelter. I'm eligible? No. It's only for working in hospitals and healthcare sector. Fidelia, I started working in September 4 as a PSW. I have worked for 750 hours already in 5 months. Please, do I qualify? Again, you need to be, they said at least 24 hours from March to August. Then I don't think so you qualify. El Nika, my work permit is currently expired. I applied for new one, still waiting for, can I send the copy of the expired one, my receipt of the new one? El Nika, Paul, there is something that is called employee status. If you apply for your work permit before the one that expired, then you just need to send proof that you applied before. Like if you apply through the GCKey account, you should have a proof letter that says this person applied for the work permit, or if you don't have the letter, with the receipt payment. But it needs to be, you will have employee status if you apply before expired. Then you will not have a problem. But if you let your work permit expired and you apply 2-3 months later, I don't know if IRCC will accept that, because it says valid, and valid means employee status if you apply. For example, my work permit was going to be expired on September 5th, and I sent the application on August 31st, then you have employee status. Working age, Siboka. I'm working as a newborn care specialist with Pneumomy Company as an independent contractor for September. I work 120 hours as a newborn care specialist. Siboka, I will go and check the NOC, the National Occupation Classification, because I'm not familiar with your kind of work. Sophia, I'm on employee status and I could apply for the pathway. If you have employee status with your work permit, yes. Okay, hello, I'm a refugee claimant. I'm working in hospital as a screening guard. I don't think so, Askisman. Please go and check the NOC, but I don't think so, but it's tricky because you are a guard screening in a hospital. I will go and check the NOC to see. When you go and see and check the NOC, they said if you meet most of the description of the job there, then you can apply. Then go and check the NOCs that are in this presentation or in the link that I provide to you. In Egypt, I serve and feed residents, assist them with their needs, give support and companion. Depends where you work in Egypt. If you work in a home, in a private home, no. But if you work in a private home because you work with an agency that sends you, I think you qualify. But again, you are not telling me where you are working. But if you work in a private setting, no. You need to be working in a private setting, but through an agency that do that kind of work. Sophia says she is PSW, but again, go and check the NOC, and if you see that you are doing most of the description jobs there, then you will qualify. Chichi says, thanks, I couldn't sleep at night. God bless Canada. Okay, Chichi, yes, don't worry, you will qualify. The problem with your child is not a problem anymore. If I'm working with two different agencies, do you need to provide letter of employment from both? If you have a way to prove, like with pay stubs, that you are working on the other one, no. But I will try to get from both agencies. But if you have problem with what agency, then see how you are going to prove it. Go into the checklist and they will tell you if you don't have a letter, what other things you can send. But the pay stubs work. Assumpta, I had no chance to work because I was taking care of baby. She has newborn. So what I can supposed to do? No, sorry. Assume that before you having the baby, you work at least 120 hours, but you had to stop. Remember, you can get the rest of the experience until August 2021. But if you didn't work even 120 hours during the pandemic, sorry, you don't qualify. Miriam, I have a degree but no work experience. Can I apply? No. Ajisha, physician assistant working in private clinics are eligible? Yes, I think so. One of the knocks is physician assistants, but go and check if you are a physician assistant and you are doing most of the things that are saying there. Because exactly, I don't know what is a physician assistant. But it doesn't matter that it's in a private clinic. Sophia, I applied for a work permit the first time since January this year, still waiting. You applied for the first time in January, but Sophia, are you a refugee claimant? Do you have the refugee ID? Or you are still waiting for the eligibility? If you are waiting for the eligibility, they will not give you a work permit. But Sophia, I think it's better that you call me and we can talk. Okay. I work in group home with persons with disabilities under Christian Horizon. Which knock do I apply? Go and check the notes. I'm not familiar with some of these settings. Then you are the one who needs to go and check the knock again. If the knock you see, okay, I'm doing this. It says it says it in the policy. It says go and check the knock, and if you most of the things that we mentioned there in that knock, you are doing it, then you qualify. But I don't know what you are doing in a group home, and what is the name of your job. Fidelia, do they have any plans for those that are working in the second phase of COVID? Not yet. We are still asking that they should include not only those that work as in healthcare, but anyone that was considered essential workers. Then I don't know, Fidelia, they are going to do something. In Iquijoy, I have been working in a COVID outbreak retired resident as a PSW, giving direct care to COVID positive patients, and at least no hospital. Yes, in a retired resident, yes. Joy, yes. Okay, Olusegun, I'm an international trained doctor who volunteered and worked between May 11 up to now, but I do not have PSW certificate, though I was employed as a healthcare aide in my contract letter. I have more than 100 pages staff. Since May, my lawyers say I'm not qualified except I get PSW certificate. Is this true? Oh, Lusegun, I think it's better that you call me and send me an email, and I will do more research about this, okay? Marianne, I am PSW student, will be qualified to apply after I get 150 hours required for the second batch. We don't know. They are just, this is only for those that work 120 hours between March and August 14. María, yo soy home care. María, no, I'm going to answer this in Spanish. María, si usted cuida a alguien, un paciente en la casa, pero si usted no está ahí a través de una agencia, no aplica. Joy, I work in assisted living home through an agency. If you work in an agency, then go and check the NOC. Okeleke, I'm a PSW, but I work in a nurse aide in a nursing home, and I work as a PSW in an agency. Yes. Yeah. Okeleke, it's nurse aide and PSW, both of them qualify. Go and see the NOC. How much is this for the whole process? Again, it's 150 for each adult that is going to be applying. That is a dependent. Dependent means common law, spouse, and children under 22 years old that are here in Canada. 150, 550 for each adult, 150 for, 150 for each adult, 150 for each child. And at the end, if you qualify, they will ask you to pay 500 for permanent residency for each person. Teboka, to be clear, my work is take care of newborn. No. A home setting, no. You don't qualify. María. María is asking in Spanish. María, así usted está esperando, usted me dice que usted trabaja en una casa, pero me puede llamar y miramos mejor, pero creo que no aplica. Ana, the reason that I was denied says no convention refugee and no person in need protection. I'm qualified to reply because I made other qualification. Yes, Anna, you can apply. Hala, would you kindly post your contacts? Okay, yes. We will send it through, we are going to send you a presentation, then all my email, my phone number is there. Miller, my wife is working like housekeeper and sanitizer in retired residence, that she can apply. Miller, go and check the NOC. If she's doing what is described in the National Occupation Classification, then she can apply. Hala. Hala said, in this package, similar to the PR status for protected person. If so, aren't the dependents become PR along with the main applicant, even they are outside? No. Go and check the who can apply and how to apply, and after you apply. It says that it only will provide the permanent residency for family members that are here, dependents. But if your spouse or children are outside, you need to become a permanent resident and then do a sponsorship application. Joy, I started working in August 2019. I work in a long-term care through my agency. I serve and feed residents. Even those with COVID, I assist residents with their daily needs. I work as an orderly, but no certification, but got on the job training. Do I qualify? Many people is asking about the qualifications if they need a certification. Sorry, I need to do more research about this. Okay. How long will the process take? They say they will try to do the best, to do the processing as soon as possible, But remember, sometimes there are complications. What can be a complication? Any person that wants to become a permanent resident, they need to pass security check background. And the security check background takes time. Depends. I have people that, for example, are from Nigeria, but they were living in the United States more than 6 months, or they were living in Europe. Then if you were living or visiting another country more than 6 months, they will ask a security check background and a criminal record for that country. For example, the FBI records from the United States, it takes time. Then it will put delays on that application. Then it's going to be different, depends of the complex of the case. And one complexity is that, for example, you were living in the United States, they will require it not only from Nigeria, but FBI records from the United States. And the pandemic back home, the criminal records get delayed. For example, if you are from Mexico, I know because the pandemic in Mexico, many criminal records have been delayed a lot, then that will add more time. Yeah, then we don't know how long it's going to take. Okay. Okay, thank you for all the questions. And again, we are going to send you the information here. I'm going to put the information again. You can, for now, you can take a picture. This is my email, this is my phone number, this is my extension. And for those that were asking about the if they need a certification or if they got training on the job, I need to do more research about this. Then give me some time and I will get back. If you write me an email, I will get back to you, okay? Thank you so much for being here. Take a picture. This is our contact information. Thank you so much for being here. I hope you understood more of my explanation. And again, if you need anything, please contact us. I'm working until tomorrow. I've been working from the whole pandemic time, extra time. Then I really need a break. I will be back on January 11, and as soon as I get on January 11, you can contact us, and I will try my best with the rest of the staff to check your application and make sure that you qualify. But please do your homework, okay? Get the documents, go and read the guidelines, go and fill out the forms the best that you can do it. I know that many lawyers and immigration consultants are offering to do it. If you have the money, go ahead, do it. If you want to do it as soon as possible. But if you don't have the financial means, we are here. I will try my best, and the rest of the staff will try the best to support you. But you need to wait for us until January, okay? Then thank you, and if you have any questions, please email me. Bye. Okay, have a great weekend and a safe holidays for all of you. Thank you.